So now let's move on to healthcare. Do you think, this is a red and green question, do you think internationals are satisfied with the healthcare system here? Thank you, lovely audience. Now let's get our thing back to try to ask them about why they put up the red card. The waiting times for, we'll start this time with Koen. The waiting times for GP appointments are long, and not to mention the specialist appointment times. Not only wait times, but also the perception of internationals regarding healthcare is a concern. There are many examples of internationals traveling abroad or to their home country for healthcare. Additionally, with the increasing population pressure, how does your party plan to balance demand and supply locally? That is the key here. You have to address it based on the local situation. Thank you.
Thank you, Bina. Yeah, this question has multiple answers because it's also a cultural thing. We Dutch people, if we're sick, we take paracetamol and you go to the huisarts and he says, you'll wait 2 weeks and then come back, and if it's not over, then we're starting to look. And if you go to another country, then you go to the doctor and immediately they put a lot of antibiotics in your system. So it's also a cultural thing that we have to accept. And but that doesn't mean waiting times are good. I work in healthcare and we have a waiting list of more than a year. This is mental health care. This is way too long. And we have to solve this by doing a lot of things. First of all, we have to invest in also study programs. So we get a lot more workers in the industry. I see I have to keep my answer short. So I will also say that also for this, learning the Dutch language is very important because then you know your way around the healthcare system a lot better. Thank you.
Virginia?
Well, this will become increasingly difficult because as the city grows, all public services come under pressure. And also our healthcare is very expensive. And there also are long waiting lists, especially when mental health care. And it doesn't help that the national government also is cutting budgets. That's why it's incredibly important to focus on prevention. Cleaner air, more green space and more pleasant places to spend time and walks are beneficial for mental health. Promoting better and healthier food and ensuring that we make this easily accessible in Eindhoven. Addressing poverty is also crucial because living in poverty is and debt is extremely harmful to health, and support for dental care is very important as well, since poor oral health can negatively affect overall health and increase the risk of cardiovascular disease and also diabetes. So that's our point we think very important to focus on.
Yeah, almost every international citizen I speak to is a bit surprised about our healthcare. They go to the GP with a health problem and then they get the response, well, just take a paracetamol and come back in 3 months. 2 weeks maybe, indeed. And I think that's why it's important to have a cultural sensitive healthcare, but also provide clear information to internationals about our system. And also, we should invest in prevention, for example, by making sport locations more accessible, but also provide places where you can go to if you struggle with mental issues. A lot of international students struggle with mental issues, so it's really important that also they can find a place. And furthermore, the shortage of doctors, nurses, healthcare problems. While a lot of spouses have a healthcare background in their home country, but now they find it difficult to find a job because the rules are not compliant. So we find it really important that we set up programs that also these spouses with a healthcare background can find a job in the healthcare.
Yeah, I agree with Virginia and Eva on most things because the waiting lists are long. Mental health is an issue. The list goes on, but also the boring answer is mostly it's the national government who's responsible for this, and they have dropped the ball big time. And the next budget cuts are coming. So yeah, we do what we can, but I'm afraid we can't do much to put the healthcare in the right way for everyone, Dutch or not Dutch. Yeah, so that's yeah, sounds pessimistic, but I think that's realistic.
Thank you. Well, all the discussions I've had with international people, also with Alina, they share with me like the same stories we've heard before. You go to the GP and they give you paracetamol. Sometimes it goes well, right? They don't give you paracetamol, but they give you ibuprofen. So then it's everything is going well. But of course, it's a big problem, and also things we hear is that people go back to their home country to visit their own GP. So that's something we need to take very seriously. One thing is better information, I think, in English, and not only English, but also all the other mother languages of all the internationals we have in Eindhoven. And we should make sure that there are more GPs and doctors and all medical personnel in Eindhoven. So one thing we should discuss is maybe make sure that they have housing, for instance, because also they cannot find houses.
I think what Chris just said from D66 is very important. As the city grows, there's going to be an even more pressure on GPs, and the amount of GPs that we need is only going to grow. So with every project that we do, that we make, like big housing projects, we have to look at the broader sense of what does this place need? Because you can build a million homes, but if you don't have enough GPs, you might as well not go and live there, because, well, of course. So, as Chris already said, it's very important to see how can we attract more GPs to come here. First is, of course, maybe prioritize giving them housing. Same goes for nursing staff. That's one of the great ways to get more. I think that's the easiest way to get the waiting list down, is get more people here. And I also think that it's a part of the cultural question where, I mean, if there's a saying, the Dutch are friendly, not friends. And the same goes for GPs. You have to make an appointment to see them, and that's very different everywhere. Yeah.
I had to laugh about the different examples. When I was living in Papua New Guinea, I had a small infection and I went to a doctor and he gave me this antibiotics, and I called my friends who are doctors in the Netherlands and they said, well, we only would give this in the hospital. So I think there are indeed, I know there are quite a big cultural difference in certain treatments. I don't think as a local government we can do very much about that. But what we can do is about availability and capacity. And I think many great ideas have already been heard. Indeed, the ideas and initiatives of also having these spouses of expats with experience coming in to help them to integrate it, to make it easier, because we're making it quite difficult. But also in terms of in the development of the city. When, for example, now when we are building homes or we are making certain neighborhoods more dense, we just look at homes. We don't look at livability, for example, not just in terms of availability of doctors, but also schools, public transport, and so on. So it needs to be an integrated growth of these neighborhoods, of these cities, making sure for everyone new there is enough space and enough doctors.
Yeah. About the question, are you happy? No, you are not happy, because your expectations are much more different than what you're used to in your own country. But most of the people have had the luxury to have a private insurance or private doctors or whatever. In Holland, the system is different, and we must be happy that everybody can attend to the doctor. Everybody can go to there. Everybody is the same, have the equal chances to do it. That there are lots of waiting lists, yes, I do agree with you. That we have to take care of the municipality, that there are enough GPs, yes, I totally agree with you. But also I would say, many things are already said. there's also a little cultural difference. The paracetamol, we talk about it already lots of times. When you're 40 degrees, the first thing they do, they give you paracetamol, and with 38 degrees, there's already panic in the countries you are coming from. So maybe these expectations are sometimes too high or too low, but I think information is very important. Also, one thing more, maybe it's something also for the companies, the international companies, to make sure that they can provide doctors in your own culture or in your own language or whatever. That also would be very important.
Thank you, Daniela.